Hello, my name is Beth Cohn-Converse, and today I'm presenting my infographic for healthcare professionals. The topic is medical cannabis and migraine. It's important to understand that we could use medical cannabis for both prevention of migraine as well as treatment. To identify migraine headaches, we need to understand that they are a complex neurological disease involving vasoconstriction of blood vessels in the brain, creating various symptoms and severe headache. Often the severe headache is a hallmark of migraine headaches. Phases of migraine that have been identified are the prodromal phase, the aura phase, the headache phase, and postdromal phase. The prodromal phase for some people can occur a few days or a few hours before the actual onset of a headache. Prodromal phase could include things like stiffness or pain in the neck and shoulders, a feeling of feeling out of body or not quite right. Some patients say they feel fatigued. The aura can include some of these symptoms as well as some visual changes and also paresthesias in the hands, face, or lips. The headache phase is the actual pain phase of a migraine headache. And the postdromal phase can include symptoms that would be related to the actual headache, but they can also stay for a few hours up to a few days after the headache has ended. Some patients also report only visual migraine in which they have visual changes, however, no headache. There are numerous signs and symptoms related to migraine headaches. This would include changes in mood, vision changes, sensitivity to light, sound, or smell. Many patients report feeling nauseated, actually vomiting or dry heaving, and having profound fatigue. Other people do report things like out-of-body sensations and numbness, tingling, or a sensation of feeling cold in the extremities. Nearly 40 million people in the US suffer with migraine headache. Why would we consider the use of cannabis? We need to look at our endocannabinoid system. This is our system in the body that regulates homeostasis and keeps everything in balance. This would include things like our blood pressure, as well as circulation and many other things that the body does on its own. Some research has shown that the ECS being deficient in producing these chemicals to regulate homeostasis may actually lead to migraine headaches. Many people think of smoking marijuana as the only way to use its benefits. However, that is not the case any longer. There are many safe ways to use cannabis. Things like tinctures and edibles allow a patient to have better control and be able to titrate their doses. The compounds of CBD and THC are the ones that we're most familiar with in cannabis and can help with reducing pain and various other symptoms, as well as play a role in being preventative because of the relation to the ECS. A 2018 study found that cannabinoids present a promising class of compounds for both acute and prophylactic treatment of migraine pain. And this is wonderful to know. Cannabis is system modulating rather than symptom modulating. And most of us would like to help provide support for our entire bodies so that we are working in a more preventative way and not only treating when patients are struggling or suffering. If you would like more information, you can contact the American Medical Marijuana Physicians Association at www.ammpa.net. There are a variety of support components there that patients can read about how to safely utilize medical cannabis, and other practitioners can do so as well. You may also contact me at my office at 248-442-2800. I have listed sources on the second page of this infographic, which lists different resources I use to create this infographic, as well as studies to support the information that is on my infographic. Thank you.